This is still VSA. Breast cancer is prevalent and a life-changing disease that affects thousands of women worldwide. To promote awareness, it is essential to equip women with knowledge to detect, prevent, and treat breast cancer effectively. In light of this next conversation is narrowed down to breast cancer awareness. And of course, joining me to shed more light on this and also, discuss matters arising around it is Dr. Adewunmi Alabi, consultant, radiation and clinical oncologist, NSIA-LUTH Cancer Center, Lagos, Nigeria. Thank you so much for your time.
Thank you. Thank you, viewers. And thank you, Dapo, for having me on the show.
Great.
Thank you.
Well, just to, lay the foundation, what exactly is breast cancer and how does it develop?
So in the language that our viewers will understand and everybody will get, we usually say breast cancer is a swelling that can occur in the breast. It can occur in either of the breasts and it can occur in both breasts. So it's a swelling that grows and the cells within that swelling or a lump, which is what people usually know it as, grows abnormally. Because it grows abnormally, it now has the ability to spread to other parts of the body. And then that way it can harm people or harm the lady or the woman that is affected. So that's basically what breast cancer is.
I mean, you talked about a swelling, on the breast. I mean, is it okay how can you detect which kind of swelling is actually cancerous? I mean, Is it every swelling that we should be, conscious about or afraid of?
So that's why I use the word, it grows abnormally. So some women can have swelling or lumps and the lump can be normal. We call that fibroadenoma. So it's possible to have a swelling or lump in the breast, which is normal. But the one that is cancerous is the one that grows abnormally. And it has this ability to now cause damage to surrounding tissues. It can go to the brain, it can go to the lungs, it can go to the liver. And that way, it can kill that individual. And so for us to be able to say which cancer is normal or not, when you see a lump, you need to see the doctor or you need to see a trained medical person because they are the ones who can tell you this lump is normal or this one is abnormal. You can just, the woman may just notice a lump but may not be able to say categorically whether this lump is okay or not. So you need a trained person to examine, to look at it, to do a few investigations, ultrasound, mammogram. Sometimes we may need to put a needle through the person's breast to take out a few samples. Okay, we call them cells or tissue. And then we put it under slides and look to see if there are malignant or cancerous cells within that lump. So we have a lot or a few investigations that we can actually do to decide which one is cancerous and which one is not.
Okay, now aside
so looking at it, you cannot say yourself.
Yes. I was about to ask that aside swelling, what other symptoms, can you look out for to know that, this is a red flag?
Okay, thank you for that. So this is October. Every year in October, we celebrate what we call the Breast Cancer Awareness Month. And we use it as an opportunity to create a lot of advocacy, to tell people about what breast cancer is. Because we've discovered that breast cancer in our own environment is the commonest cancer women have. And it's not just that it's the commonest cancer, it's the leading cause of death in cancer. So many women die from cancer. And this is also a cancer that can be prevented or that can be prevented from leading to death. That's why we talk about early detection. And so our early detection message starts from you as a woman because breast cancer most often affects women. Women are the ones who have breasts. Men also have breasts. So maybe out of 100 women that have breast cancer, you may have one man having. So men can also have breast cancer. So men should also check their breasts too. If they see something abnormal, they should not keep quiet and say, oh,
I'm sorry, I want to take you on that. You said men can also have breast cancer.
Yes.
Oh, okay.
So men can have breast cancer. One the ratio is 1 to 99. So if
Oh,
you have
okay.
99 women having breast cancer, one man can also have breast cancer. So in our clinics, we have men who have breast cancer. So that's why
Wow.
even men, when they see an abnormal growth in their breasts, they should speak out. They shouldn't say, oh, but I'm not a woman, so it's nothing. So when you see something growing abnormally in your breast, you should speak out as a man. Okay, so now how do we identify what a breast cancer is? And one of the ways to do it, the easiest way to do is for every woman to be able to know what her breast feels like. As a woman, we expect that at a particular time in the month, depending on your cycle, you should be able to look at your breast, examine yourself, feel it all around, both breast and armpit, and see, is there something looking strange? Is there something I did not see last month I'm noticing now? Am I seeing nipple discharge? Sometimes you can just nipple discharge. You see maybe brownish liquid or even blood coming out from the nipple. These are telltale signs or red flags, just like you called it. These are red flags that you need to see a doctor. So they can come as a swelling. The skin of the breast can also change, can begin to look like the back of an orange. Okay, you see some small, small holes on the breast. Uh, it may become painful. There can be lumps in the armpit as well. So these are just common signs. Or you can see that there's a change in the nipple. Sometimes it can be nipple cracking, or you can see that the nipple is going inside the breast instead of being outside. Is what we call inverted, going inside. So the summary is, you see anything abnormal about your breast, don't keep quiet. Share it with a medical person. Let them examine you. If you need to do a test, if you are with a medical person and you're not satisfied with what that person is saying, look
Mm.
for someone else and seek a second opinion. Many a times, our people fall into wrong hands just because they've gone to somebody and the person says, oh, don't worry, it's just an infection, it will go. And then by the time the person comes months down the line, it has become advanced. So we want early detection. We want women to know what they need to do in terms of their own personal examination. So that's what we call self-breast examination. And then we do have what we also call clinical breast examination. This is the one that you need a trained medical person to examine you, to check your breast, to see if there's any lump or any abnormality, change in the skin, discharge, redness. These are red flags.
All right.
Then apart from that, then investigations can now come up, and
Okay.
the medical person will know the appropriate investigation for that age group. But we also advocate that women who are above the age of 40 should go for what we call mammograms. Okay, because a mammogram is like an X-ray of the breast in which the woman does and can pick cancer cells, or can pick lumps that are cancerous.
I'm sorry,
Can give the
I
doctor
want you
an
to take
idea.
that again. You said women above the age of 40. Is it
40 years.
irrespective of whether you are seeing signs and symptoms or not? It's just advisable
Exactly.
as
So this is what we
routine.
call
Okay.
this is what we call breast screening. So women will say, how do I screen? So we also advocate that women should do what we call breast screening. So we advocate and say every 2 years, a woman should have a mammogram done, which is an X-ray of the breast. So
Mm.
every 2 years, you do a mammogram. That X-ray can pick an early sign of breast cancer. And so if it is picked, then the person goes to the hospital, tests to be conducted to confirm if it is cancerous or not, and then the doctors will take it from there. Women who are less than 40 are also privileged to have what we call breast ultrasound scans. So we have some highly sensitive ultrasound scans that can actually pick when a lump is also abnormal, and this is also effective. Now, for people who have a family history, or probably their aunt died of breast cancer, their mom had breast cancer, their sister had breast cancer, or their father has prostate cancer. So when there's a family history, for those ones, we want to do a very close monitoring. We want them to come to the hospital more regularly to have their checks. So they may be privileged to have yearly mammograms. Okay, depending on what the doctor picks, will determine how often their mammograms will be. So,
All right. Now let's.
examination and investigations.
Okay, great. I mean, let's talk about the source itself. Now, can one say what exactly is the reason or the source of the cancer itself? Does it have to do with lifestyle? Some will say maybe ingest of excess alcohol, or maybe smoking and all of that, or nutrition? What exactly is a contributing factor to chances of breast cancer?
So when we talk about what causes cancers generally, irrespective of whether it's breast or cervical or prostate, we usually say we don't know what is causing it. But what we do know is that there's an association. There's there's something we call a risk factor. We have what we call risk factors that can predispose woman A from having breast cancer and woman B does not have breast cancer. The first risk factor that we will talk about is the fact that we are women. So every woman is at risk of having breast cancer because we are the ones who usually or almost often have breasts. And because we produce something we call the estrogen hormones, the hormones that makes us women. And so because of that hormone, we have a tendency to have breast cancer. And that's why we, as women, we should always check ourselves to make sure we don't. So we have so many other risk factors. Age, as the woman is increasing in age, that's also a risk factor. We also have risk factors that talks about the family history, which I've mentioned. Like it could be family, it could be genetical, it could be genetic. So it could be the person has a mutation in his cells that is making the person have cancer or breast cancer, and it could be in the family, it could run in the family because the father had cancer, the mother had cancer. So we talk about first degree relatives, second degree relatives, all those can be contributing factors or make it a risk factor. So other factors that we talk about nulliparity, women who have not had children, okay, or women who are of age, marriageable age, 40 years and have not had children, they're at risk of having breast cancer. So they need to be
I'm
more
sorry,
vigilant.
you said women that haven't had children and of marriageable age of 40 and above are at risk of breast cancer.
Yes.
Why is that?
Yes. So women, so nulliparity is the key word. Nulliparity means this woman is married, does not have children, or this woman is not married and is above the age of 40, 45, 50. So they're at risk of having breast cancer. Yes.
Why is that?
So for such individuals, they need to do more close check because at that time, when a woman is pregnant, the woman produces what we call, remember we said women produce estrogen. And so for every time a woman is pregnant, the estrogen cycle is broken. The woman no longer sees her period, and so because of that, she does not produce estrogen. And so that's protective for the woman. But a woman who is nulliparous continues to see her period every day for the number of years that we have counted. And so because of that, she's at risk of having breast cancer. So we need to have a break in the cycle of the woman. We need to have a break in the production of estrogen levels in the woman. And so we also talk about a long estrogen window. For example, women who started seeing their period very early, we call that menarche, and they start seeing their period as early as 9 years. Girls see their period as early as 9 years, 10 years now. And then for somebody who doesn't stop seeing the period, we call that menopause till about the age of 50 or even 55 for some women. So they are exposed to estrogen for a long period. So we call that a prolonged estrogen window. And so because they're exposed to estrogen for that length of time, they are also at risk of having breast cancer.
All right, now let's talk about
smoking. You mentioned smoking lifestyle.
Okay.
Lifestyle, smoking, alcohol, yes. They're also contributing factors. People who are obese, women who are big, okay, they also have a risk of breast cancer.
Okay, now let's talk about treatment. Now, for so many people, just for you to clarify, some of the opinion that once a cancer is detected, it's an automatic, for want of words, death sentence. At what point is cancer, will I call it, dangerous or maybe life-threatening? And also, let's look at treatment options. For cost, efficiency, or because of the amount required in treatment, some opt for local or, traditional, will I call it, remedies right now. Is that, a verified option in a way to go? So let's talk about treatment, and also at what point is the breast cancer itself, when is it dangerous?
When we talk about treatment options are available, quite a number of treatment options. And with the advances we're having in the world now, a lot of treatment options are available, not necessarily chemotherapy, not necessarily removing the whole of the breast. These are the things that scare people. These are the scares that people have and do not show up for treatment. So all you just need to do is make sure, go to the hospital and ask for what options are available. So we have what we call chemotherapy. Chemotherapy is the use of cancer medications to either shrink the tumor or prevent the tumor from spreading to other parts of the body. We also have what we call surgery. Surgery can be mastectomy, that is removal of the whole breast, or a partial removal of the whole breast. The good news is when women present early, they no longer need to have their breast removed. They can have what we call a partial mastectomy, which is like a wide local excision, just a part of the lump or where the lump was is removed. Or they can even have mastectomy and have immediate reconstruction. They can get an artificial breast that nobody, they put on their clothes, they still have their normal life, and nobody can actually know that they don't have one breast in place or the other. So not everybody needs to have what we call a total breast removal, a mastectomy anymore. We have different treatment options that are available for women now. We also have the use of the radiation machine, radiotherapy, which is also used to like sterilize the area of the surgery so that the cancer doesn't come back. We also have other treatments like targeted therapy, immunotherapy. All these treatments, they're available in the country. We'll get to cost now. So, but they're available in the country, but every woman should know that they owe themselves a responsibility to decide whether to live or not to live. And to live means that you want to have treatment and you want to have it early enough. When we have patients who present early, their chance of survival is very high. The rate of survival, the way they will do well is very high. But when patients present late, after they have tried different types of herbal therapy, different types of all sorts, then they will now come back and say now they want treatment. Then it becomes late, and then if the patient passes on, what the people around will hear is that, oh, the patient took chemotherapy and died. Nobody is going to ask, at what point did the patient take chemotherapy? Was it when it was advanced or was it when it was early? So some of these things are the things that prevent people from coming to the hospital to come for treatment. In terms of cost, the federal government has an initiative now in which some special institutions, some government institutions are actually able to subsidize the cost of treatment. And there's a special program, the CAP program, which is a government-initiated program in which patient pays half the fee for the treatment. Then we also have so many HMOs now who also cover cancer care. Unlike before, we didn't have all that. We also have NHIS also being able to provide cancer treatments or drugs for patients who are affected with cancer.
Now, let's talk about the availability of these options, particularly in Nigeria. How would you rate Nigeria's battle and also treatment against particularly breast cancer so far?
I would say we have come a long way and we have done well. So we have done well because in the far past, many of these drugs, like I said, targeted therapy, immunotherapy, where the patient doesn't really have to have the side effect that people fear with chemotherapy. So many of those drugs are now available. Yes, they may come at a cost. They used to be so out of reach then in those days, but now people can afford them. They're available now, they can afford them. And then we have so many NGOs who are also partnering to help patients to go through with their treatment, sponsoring them, paying for their treatment. Then we also have some like clinical trials are ongoing now where patients can access cost of care and treatment, but you just need to know which hospital to go to so that you can get this treatment and have access to it. So the treatments, they are available. They may not be readily available all over, especially when we talk about radiation treatment. Like the radiotherapy machine is a highly sophisticated machine, very expensive. And so the government has not been able to provide this machine in every state in the country. But I can assure you that before the end of this year, many radiotherapy facilities and centers would be optional and operational, and people will have access. They don't need to travel far distance to get to access this treatment. And then the more machines we have, the cost of treatment will also drop and people will be able to readily afford it. So people don't really need to travel out again. There's virtually any kind of treatment in terms of cancer treatment that we do not have in Nigeria. We have everything available in terms of drug, in terms of machine, in terms of expertise. We may not have enough hands, okay, but in terms of expertise, we have them all in the country.
All right. I mean, before I let you go, I'm still going to dwell on cost. Can you just give an estimate or range, particularly in Nigeria, I mean, for breast cancer treatment, for, people who might want to venture into that, at what range in terms of cost should they be looking at?
So, to answer that question, breast cancers come in stages. There's what we call stage 1, stage 2, stage 3, stage 4. So I would like to say, okay, for someone who has early stage cancer, how much will his treatment? And then we also look at, so some patients may need a particular drug, some patients may not, because we also ask the breast questions. What kind of treatment will you respond to? And so when the breast responds back and through our investigations, we'll be able to know what drug. Those are the innovations we now have. We can understand the language each breast cancer is speaking, and we can treat patients differently. So I'll say on the average, 2 million to 2.5 million, a cancer patient will get all treatment necessary.
Mm. Thank you so much for your time, Dr. Adewunmi Alabi. Of course, Chief
Thank you for having me.
Consultant, Radiation and Clinical Oncologist, NSIA-LUTH Cancer Center, Lagos. Thank you once again for your time, Doctor.
Thank you. Thank you.
And of course, that's a wrap on the show today. Just remember, early detection as regards cancer saves lives. Let's do this again tomorrow. My name is Dapo Adegboye. Bye for now.